Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi there, everybody. This is Dr. Brian Jackson, and I'm here with my dear friend, Di McQueen and partner. She's a licensed clinical social worker, and we wanted to talk today about a topic that we feel is very important, and it's an acronym, and it's called H.O.W, and H.O.W stands for honesty, open-mindedness, and willingness. So in families, a lot of time, it's hard to be honest with yourself or honest about the situation. I'm not saying that you're being a liar, but I think our dishonest thinking may get to a place where we say, oh, this person really doesn't have a problem, or it's not really that bad, or it's not really affecting me, when in fact it is. And so you have to be honest with yourself that there is a person in the family that has a substance use disorder. It is affecting you, and you need to try and accept that. And once you accept that, then the ability to be open-minded about it, as opposed to being closed-minded about it and just kind of turning a blind eye and not wanting to look at it because it is so painful, is really, really important. So Di, you want to talk a little bit about open-mindedness?
Sure, but also let me just jump back for a second on the honesty part, right? Like, it's really easy, I think, a lot of times for family members to look at the honesty of the family member that has a substance use disorder, but they don't necessarily look at the honest part of their responsibility in what's going on.
Exactly.
It's very easy for us to deflect and look at the person who has the problem, and it's always their problem, right? Their fault. They're the ones that are causing me to act this way. They're the ones that are causing, the family to be so dysregulated and causing all the issues within the family. And what really is beginning to happen is that by the time we get to that place, everybody is dysregulated. And the honest truth is that I'm now dysregulated, and I'm starting to act out, and I'm starting to be part of the problem. And so, bringing that back around too, I think is really, really important. Would you agree, B?
Yeah, taking a look at your own behavior in an honest way,
Right.
um, because it's real easy to deflect and put the magnifying glass on the person who has got the issue, but not see your part in it. And how do you make the changes? Well, you can only make the changes if you're honest with yourself about your behavior and how you're engaging with this person or enabling this person, or in denial about what's going on within the entire family system. And so that's
Exactly.
why, you need to be um, open-minded about what's going on once you become honest with yourself.
Right. Yeah. So, I mean, the open minded part is really the solution, beginning parts of the solution, right? Where we start to really see that there is a problem. I'm part of the problem, and I need to start to understand new ways of doing things, things that I maybe never dreamed I would want to do or even part of. Like, for instance, in my own situation, I never really realized that I was starting to get angry. I would have told you I was never angry about a thing, and I actually was extremely angry, and I was starting to really get frustrated about everything that was going on, and I didn't think I was really part of any issue whatsoever that was going on, and I didn't realize that my behavior was actually starting to change. So when I started to realize that all of those things were beginning to happen, and that I was starting to act in new ways, in different ways, I began to hear people tell me that maybe if I could keep an open mind about new ways of doing things and step away from a little bit, act a little differently, and just hear that there might be other ways of trying things and a solution to the problem. Like, for instance, maybe instead of pointing out to the addict that I knew they were messed up, and just be quiet, and listen to the situation rather than have to point out what was going on. Because I always knew when I was messed up. I didn't want someone telling me I was messed up. I already knew that. I didn't need someone telling me that, or that I had messed up a situation. I didn't need someone to tell me that. I already knew I had done that. If I didn't show up to work or whatever the situation was, or if I showed up late, I didn't need someone to point that out to me. I was well aware of the fact that I had done that. So I learned to start to, keep my mouth shut. And that was an open minded, behavior for me, to just go like, oh, I don't need to say something, even though it was the right thing to do. I didn't need to point that out any longer. So, becoming open minded became a new way of life for me. So that, there was all kinds of things that started because I was open minded, and all kinds of new healing behaviors began to enter my world. I'm sure you can think of a few yourself, Ruby.
Yeah, I mean, the open-mindedness part of it is really a precursor to making a change. And making change is not easy in terms of our behavior, the way we react, and learning how to respond or to not respond. So once you become open-minded that maybe the way you were interacting with that person really wasn't working, it wasn't the most healthy way to interact with that person, that you now are open-minded to suggestions from other people as to how you might be able to handle that situation. It's really hard to figure it out on your own. I mean, you can drive yourself crazy ruminating about the same thing over and over and over again. And so the open-mindedness, you're saying to yourself, you know what? I can't figure this out on my own. And maybe I'm open-minded to different suggestions that people might make, people like Di and myself, or other people that have been through the same situation with family members, and see how they did it. Nobody likes unsolicited advice, but you certainly can ask family members, counselors, what would you suggest that I do that is going to diffuse this toxic situation that's going on based on the way that we have been dancing together. And when I say dancing together, the way we've been interacting as a family member with a person who has a substance use disorder.
Exactly. And it's not just, the open-minded to new ideas, right? But it's really just, not just our thoughts, but our actions, the way that we, interact with other people, but the way that I interacted with myself. That was a whole new way of trying to do things as well. I had no idea that some of the ways that I did things for me and with myself were also, with a mindset that was very close-minded, right? I knew one way of doing things, and I knew that that was the way that it had always been done, and the only way that I knew how to do this quote unquote one thing. So, it's not just with others, it was with myself as well. And so I had to learn to become, more open-minded with me, which leads us to that third little thing, right? That
let me jump back there on
please.
the open-mindedness, if you don't mind. So it's really hard to think your way into a new way of acting. So
Yes.
with the open-mindedness, you want to act your way into a new way of thinking. And, that's the outward sign of an inward change, that you are open-minded to things that will be beneficial for you in terms of the way you act, that will help change the way you've been thinking. And I'll let you go on to willingness.
No
But
problem
I had
at
to put
all,
in my
Dave.
I had to put in my 2 cents.
Yeah, but that 2 cents is a really important 2 cents, and that's one of those open-minded things that we're doing, right? Which leads us to the W, right? Which is the willingness to be able to do any of these things differently. And one of those classic, cliches that we both, talk about a lot is when we have a client that does the yes, but. When I get a yes, but, I know, oh, we're closed, right? Immediately I go, our willingness is not there. And we need to have an open willingness to be able to go, is there an ability to want to change? And that really is all we need, is an open-minded, willing opportunity to go, I can start there. And for us, in the coaching counseling world, when I hear yes, but, it immediately tells me I got a person who's closed down and has a shield on, and I'm going to have to try to figure out a way to get through. And I usually do it in a joking way, but we try really hard to go, this person has been hurt and is guarded, and we need to figure out how to be able to open them back up to maybe the potential possibility that it's okay to let someone in and to trust that maybe there's a possibility of a different way to do this. I don't know about you, B, but that's usually my first cue, that we're going to have a little bit of a difficult time here in the beginning to slowly build some trust and slowly understand that this person is coming in there with a very guarded, and they've been through it. That doesn't mean that it's not a workable solution. It means that they're exhausted, they're tired, they're worn down, and they have been going through it for some time. And that's usually the case when you've been dealing with, addiction and the whole family system is worn out. It affects everybody that thinks that, when the addict is affected, that nobody else is. It's not true. Everybody in the whole family nucleus is just beaten to a pulp. And that's when we know we got to get in there and help. Right. And
if you come to us with just a little bit of willingness, okay, you've been honest, you're open-minded, and now you've got to take action. And so the willingness, the muscle memory is, oh God, it's hard for me to make this change. But the willingness to say, okay, I'm willing to take the advice of a couple of professionals who have been doing this for 30 years and seen families get well, seen the substance use person get well as a result of the changes that the family has made. It's the biggest gift you can give yourself, because otherwise you can just get stuck in the quicksand of what you've been doing before, hoping and praying and waiting for the person to get help when in fact they might not get help. But if you make the changes that we suggest, there's a very good possibility that they may say, they're not interacting with me the way they used to. They seem to be getting on with their lives. They seem to be happy in spite of what I'm doing. Maybe I need to make a change. So willingness is the key. Just a little bit of willingness to make changes, and it can't get any worse. It can only get better. And that's our hope and for family members who are suffering as a result of addiction being in the family.
Yeah, I think, one of those things that really helped me be whether it was on whatever side of the aisle I was on. It was amazing when, it was easier to kind of get sober, but it wasn't so easy for me to get emotionally sober. But those two words, listen and learn, when I learned to be quiet and just listen a little bit, it was amazing when I became willing to just hear that there might be a different way to do something, how quickly I was able to progress. And it's just was simple little things that I didn't realize. And, again, it was really being able to get humble by just stepping away from, realizing that there was others that were very much like me, that were experiencing similar things. I know, we all believe that we're terminally unique and that nobody else in the world is experiencing the same thing or could have it as bad as me. But in fact, there's lots of us that are having it very much the same. And when you find out that there's others that can relate to you, it really does help. And just being able to, have someone that could, help you see a perspective that you have not seen before. Because when you're in it, it's so hard to see it any other way. That pain is deep and it's wide. And it's very hard to go like, nobody else, there's no way. When I'm deep in my darkest thoughts, I can't imagine that, anybody else could possibly understand what I'm going through. So, just to take that one moment and just step through it a different way. I always remember thinking, oh, here I am. Like I keep hitting the wall. I keep hitting the wall. I keep hitting the wall. There's nowhere else to go. Don't you see that? Can't you understand? There's nowhere else for me to go. And then this little voice says, look, turn right, turn left. Don't you see? Like all you have to do, you don't have to keep hitting the wall. Turn right, turn left. There's somewhere else to go. I had no idea because I only have one way to do this. I don't know what else to do. Except there it is. Bry's little voice going, die, turn right, turn left. And there it is. So again, we think we've hit a dead end road, but most of the time there's really no dead ends. It really isn't. So that's all we need to know is that with a little help from our friends and a little how, it becomes a pretty big wow.
Yeah, and without that willingness, I don't think I could have ever turned my life around, and like you said, the terminal uniqueness that you think you have, that you're different from everybody else. And sitting in the first group therapy that I was in, I was like, me too, me too, me too. And it was just realizing that I am not alone in this, that there are a lot of other people who have suffered from the same thing. And there's a lot of other people that want to get well. And so that's when it really opened my mind to the willingness that there is a solution. And the solution will happen if I do what is suggested, or at least try it on and sit with it for a while. And believe me, it feels a lot better than the way you used to think, act, and what I had to sit with then, which was very, very uncomfortable. So it's good to be comfortable. Not that life isn't going to throw some curveballs at you, but you have the tools and techniques to turn it around. So
exactly.
That's our how.
That's our how. So come see us, or at least go look us up on our website, familyandAddictionExperts.com. We actually have some free resources on there that you are welcome to, take away for free. And you're welcome to send us a question via email at info@familyandaddictionexperts.com. Brian and I are thrilled to answer any questions you might have. Keep checking us out on our podcast, Healing Families Shattered by Addiction. If you'd like and you need a free consultation to see if we might be a good fit for you, we'd be delighted to meet you face to face on Zoom or live in person. And you're welcome to schedule an appointment with us. For now, that is our how. And Bri, always a pleasure to have a moment to share with you and help people see that there is solutions, and that is our focus. Always trying to help people get weller.
Weller. I like that. Weller.
Right.
Enjoyed being with you again, Di. Thank you so much.
You too, my friend. And you guys take good care. This is familyandaddictionexperts.com. I'm Di McQueen, joined by Dr. Brian Jackson, and we'll see you in a couple of weeks.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.